Hi, so I've chosen to do the practical on female. So, first I would confirm the medical order of an indwelling catheter. Then I would review the patient chart for allergies and physical limitations, consider their ability to assist and follow directions, as well as any presence of tubes, lines, devices that could possibly interfere with the procedure. Next, I would just gather my equipment, enter the patient's room, provide for privacy, wash my hands, put on PPE, introduce myself, identify the patient, discuss the procedure with the patient, let them know what we're doing, why, and discuss their ability to assist, ask about allergies to latex, iodine, especially those, provide good lighting, and just raise the head, not the head of the bed, raise the bed to a at least waist height. So now I'm gonna assist them into a dorsal recumbent position, knees flexed, 2 feet apart, feet 2 feet apart, and legs abducted. And I would expose only the perineal area. I'll put on clean gloves. And I would place down a waterproof pad beneath them. Then I would clean the perineal area with skin cleanser, warm water, and a washcloth. So I would clean from top to bottom, using a different corner of the washcloth for each stroke, from clean top to bottom, rinse and dry, remove gloves, wash my hands. So next I would open up my sterile catheterization kit on a clean bedside table, opening away from me, trying to maintain sterility. Then I would pick up the sterile drape, ask the patient to lift their butt for me, and so I could not tuck it in there, but slide it in there a little bit, shiny side down. Fold out the remaining catheter kit and put on sterile gloves. Then I would put down a fenestrated drape, pick up the kit with the outer drape included, move that in between the patient's thighs to extend my sterile field. After that, I would open up all my supplies, like my betadine swabs, and I would attach the water-filled syringe to the inflation port. Then I would get ready to use my lubricant. I would lubricate the catheter tip for female 1 to 2 inches, for male up to 6 inches. Then I would let the patient know that they will feel my touch. So I just let them know what I'm doing. Then I would, with my non-dominant hand, spread open the labial folds, and I'd prepare to keep them spread for basically the entirety of the procedure until the catheter is inserted and urine flow is well and continuous. So then with my dominant hand, I would use my antiseptic swabs. I would clean one labial fold at a time, cleaning top to bottom, using a new swab for each stroke. And then I would clean directly on the meatus. Then I would put the drainage end of the catheter into a receptacle so I don't get it all over the bed. Then I would get ready to slowly insert it until I get a urine return, which is approximately 2 to 3 inches. Then after that's received and drained, I would go another 2 to 3 inches, and I would make sure not to force it through the urethra into the bladder. And I would ask the patient to take deep breaths for me, and if any resistance is met throughout the procedure, I can gently rotate the catheter. So then with my non-dominant hand, I would hold the catheter at the meatus. With my dominant hand, I would inflate the balloon. I would inflate the balloon. Then I would do that by injecting the entire volume of the sterile water syringe into the balloon and just inflate the balloon. So that's the procedure. Finishing up, I would remove any equipment, dispose of sharps, the syringe into the sharps. I would secure the catheter to the patient's thighs or their leg, using like Velcro or tape. Then I would assist them into a comfortable position, making sure that the bag is below bladder level, so I could hook that onto the side of the bed, and put the bed in the lowest position, put the collet within reach, and yeah, I would give them a little bit of slack before I tighten it up, and yep, then I'll go document. Thanks.